Imagine going on vacation and suddenly you fall ill, only to hear that you can't be treated because of no health coverage and out-of-pocket cost you can't afford. The United States does not have a universal healthcare system, meaning the government doesn't provide health benefits to all citizens or visitors, and healthcare is primarily funded through private insurance out-of-pocket expenses. Universal healthcare in the U.S. refers to a system where everyone has access to full range of quality health services, regardless of their ability to pay. The U.S. currently does not have a universal healthcare system. It's a complex issue. Arguments for and against the debate centers on how to ensure affordable and accessible care for all citizens. Universal health care population due to better access to preventative care and treatment, potentially reducing the long-term costs associated with chronic diseases. A universal system could prioritize patient well-being over profit, ensuring equitable access to necessary care for all, regardless of their ability to pay. A single-payer system might offer greater control over healthcare costs, potentially reducing administrative overhead and negotiating power for essential services. Some argue that a government-run system infringes on individual freedoms and choices, while others emphasize the need for fairness in access to health care. A universal system would require substantial government funding, potentially leading to budget limitations and resources allocation challenges. The ACA was a major step towards universal coverage, expanding access to millions through subsidies and mandates. Some states are exploring innovative programs to reduce the number of uninsured individuals, such as state-run health plans and expanded Medicaid eligibility. Universal health care remains a politically divisive issue with strong opposition from various stakeholders. The UHC comes in several different forms, but the basic idea is the same across the board. The government steps in with taxpayer money to ensure that every citizen has access to the medical care they need. With universal care, no citizen is denied coverage based on their ability to pay. The sheer cost of providing quality health care makes universal health care a large expense for governments' medical coverage based on their ability to pay. The sheer cost of providing quality health care makes universal care a large expense for governments' medical coverage must be paid for by taxpayer-funded programs. A substantial portion of countries around the world have universal health care, including Canada, much of Europe, Asian countries such as Japan and South Korea, along with Australia and New Zealand. The U.S. has the distinction of being the only wealthy, industrialized nation without a universal health care. The current system. The U.S. healthcare system is a mix of public and private funding and coverage with programs like Medicare for seniors and some people with disabilities, Medicaid for low-income individuals and families, and employer-sponsored insurance playing a significant role. The United States government considers universal healthcare, single-payer healthcare, is a fundamental to the pandemic preparedness. We determined that such a system could have saved 21,897 lives in 2020 alone. Strikingly, it would have done so at a lower cost than the current healthcare system, saving the US $59 billion in 2020 at the time of the economic tumult. Universal healthcare system, pros and cons. I'll start with the pros. The pros: lowers overall healthcare cost, may lower administrative cost, standardizes services, prevents future social cost, guides people to make healthier choices. The cons: healthy pay for the sickest, possibly less financial incentive to stay healthy, long wait times for elective procedures, doctors incentivized to cut care to lower cost. Healthcare costs may overwhelm government budgets. Government may limit services with low probability of success. And here I have a diagram showing how universal healthcare works. So you have the single payer, you have mandatory insurance, and the national health insurance. And for single payer, free government provided healthcare paid for by income tax revenue, and that's a public hospital. Every citizen has the same access to government-owned services. And mandatory insurance, government-run health insurance, financed by payroll tax on employers and or employees. And that's private doctors and hospital-provided services. And national health insurance, every citizen pays into a national plan provided by a single insurance company, publicly funded and privately delivered.